Coming up right now on Lifestyle Magazine, it will affect the lives of more than 200,000 American males this year. It's the second leading cause of cancer deaths in men. We'll take an up-close and personal look at the bad news and the good news about prostate cancer and what you can do about it. Now the hosts of Lifestyle Magazine, Dan Matthews and Mike Tucker.
Thank you. Thank you so much. I really don't want to talk about our topic today. I feel very, very uncomfortable talking about this.
I can understand that. For those who are wondering what you don't want to talk about.
No, I don't even want to mention it.
It has to do with male plumbing and the possibility of somebody else messing with our plumbing.
Oh, dear.
But the reality is, when you get old enough, you finally are convinced by your wife or somebody
drags you in
that something has to happen.
Right.
And so we're here particularly with an interest in a growing phenomena, which is prostate cancer.
Prostate cancer.
And I'm going to ask our doctor about this when he comes in, but I think if we males could live long enough, we would all get prostate cancer.
That is what I've heard.
And there are various stages at which it's detected, and we can either go to the doctor at an early stage and get something good to happen, or we can wait too long and then we cry about it.
Yeah.
So that's the reason you don't want to talk about this.
Absolutely.
And the other thing, Mike, is that we men, we want to deny this kind of thing as long as we're standing up and walking around.
I'm fine.
Yeah.
I'm fine. Just leave me alone.
Not me.
No, that's right. Well, our first guest is Chief of Urology at the Loma Linda University School of Medicine, where he leads an ongoing research in prostate cancer and its treatment. Please welcome Dr. Herbert Ruckel.
Welcome, man. Thank you.
Thank you so much for being here. Dr. Ruckel, this problem of prostate cancer, how many people do you think suffer with this today?
Well, roughly 230,000 men are going to be diagnosed with prostate cancer in 2007. And of that...
In this year alone?
In this year alone. And of that, about 24,000 will die of prostate cancer.
Oh, man.
24,000 American men are estimated by the American Cancer Society to die of prostate cancer in 2007.
How far wrong was I, Dr. Ruckel, when I said all males, if they'd live long enough, will get prostate cancer?
Technically, that's a correct statement, but not all prostate cancer is the same. Okay. And that statement is based on autopsy studies where you take men that die of other causes, for instance, car accidents, and during an autopsy, you would remove their prostate and step section it in 1 millimeter sections and look at every bit of their prostate. And so using that criteria, if you take 80-year-old men, 90% of them will have some histologic evidence of prostate cancer, but the majority of those would be tumors that were only a millimeter or maybe 2 or 3 millimeters that would never be clinically significant during their natural life.
Oh, okay. All right.
And that's different than a tumor that would be of a size greater than 1 centimeter, which would have the possibility of spreading and ultimately causing death.
You heard our conversation about the discomfort of dealing with this issue. And I want to say that I'm very proud to be here today with Dr. Ruckel because he is my urologist.
Is that right?
And he has taken away all of the terrible threats that I suffered before I got to see him.
Well, good. Maybe I need to come see you, Doctor.
But in reality, there are lots of changes in the field of urology, aren't there? And as you deal with prostate cancer even.
There definitely are. But the key for prostate cancer diagnosis is early diagnosis and diagnosing and treating the right patients. But the foundation of diagnosis basically rests on three things that are important to include. One would be PSA testing, prostate-specific antigen. It's a simple blood test.
Okay.
Number two, DRE, or the famous digital rectal exam, or as it could be called, the finger wave by some of my patients. And then the third thing would be transrectal ultrasound. If the PSA is elevated or there's a hard bump on the prostate, a biopsy would be necessary. And in the old days, it was just guided by the finger. Now we can image the prostate using ultrasound and accurately place the needles in a grid to sample the prostate.
Not that I want to sound a chicken or anything here,
Sure.
but wouldn't a PSA be enough? I mean, do we really have to do the digital exam? I can't even say it. It's frightening to me.
About 20% of patients who have prostate cancer have a normal PSA, but have an abnormality that is detected on digital rectal
See, that is
exam.
just very discouraging.
The PSA hasn't been a forever measurement, though.
It came into clinical use in the United States in 1986, and PSA is far from a perfect test because there are things that can make PSA be higher than the reference range, which have nothing to do with cancer. If you have a large prostate, if you've recently had an infection, if you retain urine, if you've had any instrumentation, for instance, if you had a Foley catheter in place for some other reason and had a PSA test at that time, that would artificially elevate your PSA. And it wouldn't be cancer, it would be just a high PSA.
Now, when people talk about the PSA and the number, what is the number that you're looking for? I mean, I've heard people say 3 or 4 or something of this nature. What does that mean?
Well, that's a reference range, and a reference range is a statistical range where most normal men would fall. And initially, it was 0 to 4. But now with more sophistication, we're able to actually break it down by the man's age. So an older man has longer for the prostate to grow, and so we entitle him to a higher PSA before we're worried.
Okay.
So for a younger man, it would be 0 to 2.5, and that would be to somebody up to 60 years old. And then for 60 to 70, you'd go to 0 to 4. And actually above 70, you can even adjust it up as high as 6.5.
Okay. This is fascinating, and although it's not put my fears to ease quite yet, it has impressed upon me the importance of all this, that this is really an important thing for all of us to follow up on as men. Well, coming up right after this break, a man who knows what it's exactly like to hear a doctor say, "You've got prostate cancer." Stay with us.
This is Hello Channel.
Joining us now is a prostate cancer survivor and an enthusiastic proponent of today's high-tech response to the disease. Please welcome Ron Conrad.
Thank you very much.
So Ron, when did you find out about your disease?
I found out April of 2005.
And how was that detected?
It was detected by a biopsy, actually.
A biopsy. Had you gone in for a regular checkup?
I'd had some lower abdomen and lower back pains, and I went through a series of tests. I went to a urologist, and he did the digital and the PSA, and I had a reading between 4 and 4.2 for about the last couple years.
Okay.
And he suggested I come back in 6 months.
Oh.
And I just asked him, why not a biopsy?
Right.
Because I wanted to know.
So you were more aggressive in this. You took responsibility for this, right?
Oh, absolutely.
I think that that's key. I mean, doctors are great, and they thank the Lord for all the wonderful things they have in order to diagnose these things. But when you are aggressive and you take the lead in this, that's an exciting thing. So when they said the word cancer,
I was devastated.
Yeah. Well, what did you feel inside? I mean, what were your fears?
of leaving this world before I'd accomplished the things that I thought that I was supposed to do.
Right.
And you have a family. You got children.
Yes, sir.
Yeah.
And all of those. And were you a little hesitant to go for examinations, urologic? No. You were not?
No.
Okay.
So you were better than most of us.
Well, I had stones in my early 20s.
Okay.
So I've been going pretty much on a regular basis
Been
all
very
the
careful
years.
about this.
Yes.
Yeah.
Now, you were seeing another urologist other than Dr. Ruckel to begin with.
Yes, I was.
Dr. Ruckel, when you saw him, you were ready to act immediately. How does a transition like that work?
Well, typically, it will be because the patient comes for another opinion or another set of eyes to look things over.
Right.
In Mr. Conrad's situation, I think it was basically a scheduling issue of one of the other urologists in the area. And so he came for us to give a second opinion, and it went from
now,
there.
The introduction that Mike did was his participation in high-tech response to prostate. Tell us about that.
Well, when we went over all of the options of treatment, which would be anything from watchful waiting or close surveillance, to hormone treatment, to cryotherapy, to radiation treatment, of which it would be seeds implanted in the prostate, or external beam radiation, such as proton therapy, or radical prostatectomy. Mr. Conrad chose radical prostatectomy, and so then we discussed the various types of radical prostatectomy, basically open, the traditional type with an incision, or laparoscopic, in this case using a robot, an actual operating robot, to allow us to use instruments about the size of chopsticks through the abdominal wall. And at the end of the instruments are little hands, wristed instruments that we can accomplish a radical prostatectomy with through very tiny and small incisions.
Are there different kinds of prostate cancer that would demand that you would use one method over the other, or does everyone have the option of choosing whichever one you want?
Well, prostate cancer treatment is stage dependent as far as the treatment options. And so if a patient has localized cancer or cancer within the prostate, they have the option of choosing from the various curative treatments, which would be surgical removal, radiation treatment, or cryosurgical ablation.
Okay.
And Mr. Conrad happened to choose, after hearing the options, for him, he thought the best thing would be a robotically assisted laparoscopic or minimally invasive prostatectomy.
So why did you choose that?
I didn't want a scar about 10 inches long. I wanted to recover and get on with my life and get back to work.
So it just seemed clean and quick, and let's move on and do it.
Just Band-Aid incisions, that was it.
Oh, that's great.
And you have been more than pleased, we can tell, with the results of your surgery.
Oh, most definitely, most definitely. Everything that Dr. Ruckel informed me of prior to the surgery is exactly what's transpired, as well as what he said after the surgery.
So there were no surprises for you?
No, definitely not.
Okay.
It's just been awesome, the relationship that I've had with Dr. Ruckel, and all the young men that I come in contact with, or the older gentlemen, I try to get them to get checked out.
Yeah, I would think so. Dr. Ruckel, is it typical for a patient to be as aggressive about the potential of this disease as we've seen here? Or do most men say, oh, well, if you want to wait, let's wait?
It's the spectrum. As many different men as there are different approaches to prostate cancer diagnosis. But it's the minority of men who really take the responsibility and the leadership role. Now, of course, a minority can be 49%.
Yeah.
But more men are not wanting to deal with it.
Yeah. Why is that?
I don't know. I think that it's because it's the ostrich syndrome.
Yeah,
if they have their head in the sand and they don't see anything bad happening, then nothing bad is happening.
That's true.
And
I guess to some degree we all feel like we're bulletproof.
Men especially.
Yeah, yeah. and to admit that we've got something going on that, that is uncomfortable or frightening or threatening is not something we like to do.
We have come to a time, however, where prostate cancer is apparently not the death sentence that we used to think it was if there's early detection.
Absolutely. Since the introduction of PSA in 1986, the prostate cancer mortality rate has decreased. Now,
That's
academicians will argue as to what the reason for that is, because there's never been a study comparing men who didn't have testing compared to men who did have testing, and then you follow them until they die.
Well, we need to move on. There will be more good news about prostate cancer treatment when we come right back after this break.
Don't be afraid to try.
Don't be afraid to try.
Don't be afraid to try.
You can learn English.
You can learn English
by watching Hello Channel.
Joining us now is Bill Hull, another prostate cancer survivor with a different story. Bill, welcome.
Thank you. Good to be here.
Indeed, we're glad to have you here, Bill. I rejoice every time I hear about a cancer survivor, and being a male, I am particularly grateful for prostate cancer survivors. And your survival is the result of a choice you made for treatment. And I remember all of the inquiries you made, and what about this? And you studied a lot, and you made a choice for?
I made a choice for the proton beam type of treatment. That is at Loma Linda and various other places now around the country. Amazing, the proton beam does about 50 million to 70 million beam insertions in each treatment. And they can control the length of those, similar to the type that they burn things with a certain depth. And so at the end of each one of those proton beams, there is a little burst of energy called a Bragg peak. Dr. Bragg, a physicist back in the 60s, discovered that. And so they, of course, are using that within the treatment. So when you get a treatment, which lasts about 3 to 5 minutes, you get from 50 to 70 million of those beam insertions, and they stop where they want them to cover the area that's infected. And the Bragg peak, that little burst of energy, is what eats up the cancer.
Now, you said 3 to 5 seconds. I'm thinking about
3
Ron.
to 5 minutes, I'm sorry.
3 to 5 minutes. Yes, you did say that. I'm thinking about Ron and his Band-Aid surgery that he referred to. But your 3 to 5 minutes is over a period of months.
Yes, I can respect those who want the surgery to get it over with quick, and I had a lot of people try to get me to go that route. But after I did a lot of research, I found that I had some friends who had had some bad experience with the other treatments, and so I chose that. And found that that worked great for me. Now, I had 44 treatments, which is quite common, 44 treatments. So you have one every day for 5 days a week. So you're talking about a little over 2-month treatment where you go in each day. And to have that treatment, they have a pod. It's a part of a large plastic tube that they've cut in half, and you lay down in it and they pour foam all around you and put a top and a bottom in it, and that's your pod. Which
your mold.
Your mold, so to speak.
The nickname is a sarcophagus.
They roll you in there for the treatment, and of course, one day they inject from the one side, the other day they inject from the other side. So the only side effects I ended up with were rosy hips on both sides. But please, by in about my 3rd day, there was a little weakness, but after that, no side effects.
And you've been very happy with the results?
Very much so. My PSA, when I was first analyzed, was 7.1. And so they did a biopsy, found, of course, the Gleason score of a 6+3. And the doctor looked at me and said, "Bill, you've got cancer." Now, I can't tell you the feeling.
Yeah, I would imagine.
It's like describing an explosion, you know.
Yeah.
Suddenly, chills go down your back. You think of everything, you know, what's the future hold, what's about my family, and so forth. and you become very concerned. And then the doctor tells you the various possibilities of treatment. Now, I understand from statistics that if one member of your family, in addition to yourself, has prostate cancer, you have a 50% chance that you'll have prostate cancer.
Doctor, is that, do you find that to be true, or is that?
Well, you have a 50% greater chance. It's a first-degree male relative. It can be on the mother's or father's side. So that would be father, grandfather, brothers, or uncles.
Yeah. I understand that if you have two, that increases that 5 times. And if you have 3, that's about 97% chance you're going to have prostate cancer.
It's not that high, but it does increase the odds statistically.
Statistically, it does increase
definitely
significantly.
You know, this topic deserves a whole lot more discussion.
It does.
But what we're doing is alerting the male population, get your PSA tested.
Right. That's right.
And have a urologist. It is better to have a urologist put his finger in a very private place than it is to go without knowing what's happening to you.
That's right.
And there's a lot of change in the urologic community, Dr. Ruckel.
That's right. I came today up from Anaheim, where the American Urologic Association is meeting. That's an international meeting. There are about 14,000 urologists that are there discussing all urologic topics, but prostate cancer is at the forefront. It's probably the most discussed. And the real focus for prostate cancer is how do you make men's lives better and longer.
Right.
And so that hinges on early diagnosis. It has to do with studying the various treatments, because no one treatment is right for every man. We need to have a spectrum of treatments so we can tailor individual treatments for individual men. And there's a lot of effort into advancing the science of taking care of prostate cancer.
We men are grateful that there is all of this study going on, and I'm delighted to be here with 2 survivors.
Absolutely. Hey, we'll be right back with some final comments from our guests in just a minute.
Hello, my name is Javier. I learned English. So can you. Watch Hello Channel.
Hello. The job market is a competitive place. In today's economy, extra skills mean a better job for you. Speaking English is the skill you need for greater opportunity, more money, and a brighter future. Introducing Hello Channel, an exciting new television channel that teaches English as you watch TV. There's something for everyone, and the more you watch, the faster you'll learn. All you have to do is say hello.
This has all been helpful information, but I've got a quick question for each of you. What's your PSA right now?
0.05.
Congratulations. What's your PSA?
Less than 0.03.
That's fantastic, guys. Dr. Ruckel, do you have a final word for us?
In summary, I would like to say that the key to prostate cancer treatment is early detection.
For more information about prostate cancer, please visit our website at lifestyle.org and join us again next time for another edition of Lifestyle Magazine. We'll see you then.